Welcome back to This Week in Global Health, otherwise known as TWiGH. TWiGH is a weekly live global health news roundup. We've got our usual panel with us tonight, or today, depending on where in the world you're watching. And of course, you might not be watching this live, you might be watching it on YouTube or listening to our podcast sometime in the future, so welcome to you as well. We're going to jump right in. We've got 3 news items, we've got a science update, and we've got some job opportunities we're going to talk about. And I'm going to hand right over to Chris. Chris, can you hit us with the first news item for today?
I most definitely can. So we're going to start off by talking about global surgery or access to global surgery. Now, across the world, this is an article by the Irish Times, many more people will die from a lack of access to safe surgery and anesthesia than from malaria, HIV/AIDS, and tuberculosis combined. And while there have been huge gains in global health over the last 25 years, these have focused primarily on infectious diseases and nutrition and not focused on essential surgical care. Common conditions such as appendicitis, hernia, complicated childbirth frequently result in death, as do unrelated bone fractures. So there's a lot of DALYs that come into play here. To that extent, at the last World Health Assembly in Geneva, the WHO resolution for strengthening emergency and essential surgical care and anesthesia as a component of universal health coverage was in fact approved. This basically urges member states to identify and prioritize a set of emergency and essential surgery services at the primary care level, as well as developing methods for financing. So success in these areas and other requirements will be measured and reported at the World Health Assembly in 2017, or WHA 70.
Thanks very much, Chris. So there's going to be a link in the show notes below this video with it'll be a link to an article to give you some more information. I was reading the article today. It's really interesting. It was in the Irish Times, I think. I happened to be in Ireland, in Dublin, so I took particular note. One or two things that I noticed that really stuck out. The one thing was 2/3 of the world, that's 5 billion people, don't have access to adequate surgical care. So that's quite a striking number of people. The other thing is that 1/4 of all people globally who receive surgical care land up with financial difficulties or financial catastrophe because of it. And so there again, that highlights the importance of state-funded or publicly funded or publicly provided surgical care, and not just surgical care in other areas. And being in Dublin, I just want to give a quick shout out, and this was mentioned in the article as well, that the Royal College of Surgeons in Ireland, funded by Irish Aid, have got a collaboration with the College of Surgeons of East, Central, and Southern Africa with a view to increasing the human resource capacity to provide surgical care in Southern and Eastern Africa. So it's a fantastic initiative. I've heard a lot about it. I've met people here in Dublin that are involved with it, and as the story kind of points out, it's incredibly important. So I'm delighted that we're talking about this today on TWiGH.
Yeah, absolutely.
Great. To add to that, I actually happened to read the same article earlier today, and I was, being in Africa, I was really surprised to see that, a continent of 320 million, there are less than 1,700 surgeons in the entire Africa. So that's one surgeon for every 200,000 people. And if you compare that to a high-income country such as Ireland, which is where you're sitting, where you have one surgeon for less than 10,000 people, that's a drastic gap. And this is why I think, I remember reading that even Dr. Paul Farmer called surgery as the neglected stepchild of global health. So definitely something you should be looking more at.
I wonder if part of the reason surgery is neglected or not thought of in global health discussions is we tend to think about disease in global health discussions and in global health circles as communicable disease and non-communicable disease. And so that so often as part of the discourse, as part of the dialogue, there's HIV, TB, and malaria, and there's NCDs, which is heart disease, cancer, pulmonary, and all the typical diabetes, obesity, etc. And none of that includes the surgical burden of disease, which, as we know, is a significant contributor to the global burden of disease.
Mm-hmm. Very true, Greg. And it also it highlights the fact that about a lack of capacity. There's such few surgeons in places where so less than most of the surgery happens in where the population is less than 37%. So there's a huge gap. So there's also a capacity gap there, which must be taken into account when you think of why surgery is the neglected stepchild, so to say.
Yeah.
Right. Well, I mean, let me just also say that it's interesting to think and make this divide between non-communicable diseases and communicable diseases. Though I think surgery can kind of span some of that, and it also enters into an area of emergency services. And what in the article it seemed that they were focusing a lot on the emergency care, but I think with some of these increasing burden of non-communicable diseases, there's going to be a need for more surgery. So I think it's going to be interesting also how they decide to budget all this out, whether if it's under an NCD framework or if it's going to be under emergency care. Where does it come in?
Yeah, and a great way to sort of put into context the scale is, you know, when we talk about the burden of one disease over another, we always use a comparative approach. And so when we talk about cancer, you know, you'll often hear people say the burden of cancer, global deaths due to cancer are greater than malaria, HIV, and tuberculosis combined. So to realize that the global burden of surgical need or people dying from lack of access to these items is up there. I don't have the exact statistics, but it's clearly, you know, sizable as well. And I think people also forget too that sometimes these surgeries include like complicated childbirth. So this has huge implications for maternal or child mortality as well.
Absolutely. And one last point before we jump onto the next story, and that is we know for a fact that one of the huge contributors to the burden of disease globally, and that's certainly on the rise, is morbidity and mortality associated with motor vehicle accidents in developing countries, because we know that more and more people are driving cars. Roads are not necessarily increasing in terms of their safety in step with that. And so if you're in a car accident in the middle of nowhere in a poor country, and what you're going to need at that point is a surgical intervention very often, and more often than not, that's going to be either inadequate or often timing is a problem. So that to get to a facility that can provide that kind of surgery in time to save your life or to prevent significant morbidity will be lacking. Okay, enough about surgery for now. I'm going to jump right onto the next story. Chris, what's the next story for tonight?
Okay, so the next one is actually putting into focus the importance of community health workers and the role that they play within health systems, especially those in the global south. In a recent paper or article released by the Lancet Global Health, we were informed that more than 500 health workers lost their lives in West Africa's Ebola epidemic over the last year and a half. Now, they looked at a number of markers, and using maternal, infant, and child mortality as proxies for health system performance, the studies showed that the lost doctors, nurses, and midwives probably led to an estimated 75% increase in maternal mortality across the 3 hardest hit countries, which, if you recall, were Guinea, Liberia, and Sierra Leone. And this ranges from about a 40% discrepancy in Guinea to an over 110% increase in maternal mortality in Liberia. And these are some pretty staggering facts, and I know we've done previous episodes on community health workers and as well as even talking about midwives when we did respectful maternal care and things like that. And this just really brings to the forefront how important each person is integral in the success of a nation in treating its people.
Very true, Chris. And in fact, like, you know, just to kind of put this in perspective for our viewers, you know, Liberia, Sierra Leone, Guinea, they're all post-war countries. They were, you know, these countries already had a very high burden of, you know, maternal mortality. You know, Liberia, for example, 770 deaths every 100,000 mothers. That's a really high number. So while they were stabilizing, to put into perspective, the Ebola outbreak happened, which killed, you know, 0.1% of Liberia's population died due to Ebola, but the number was between 8 to 10% for healthcare workers. So already these are countries where they have very limited amount of healthcare worker capacity, and suddenly Ebola hits drastic, you know, 8 to 10% of the healthcare workers. So not only did that impact the maternal mortality, but also, like, you know, put this into perspective, people are afraid of going to hospitals. People are afraid of operating. You know, I'm currently sitting in Nigeria, where I've been interviewing people about impact of, you know, Ebola outbreak here. And there's so much of fear and hysteria. People are afraid to operate. People are afraid to give birth to children, to handle women with complications, and also women are afraid to go. So it's a very complicated situation, which has definitely huge implications for maternal mortality.
And then in a situation that isn't related to Ebola, but just goes to showcase and demonstrate the importance of health workers in general, when we talked about healthcare in danger and healthcare in times of conflict and humanitarian aid, again, you look at the loss of one person having these exponential repercussions down the line as far as the number of people they're able to treat and just the general capacity, again, of successful operation of a health system and treating people within a certain population.
Yeah, thanks very much, Chris. Okay, and before we go to the next story, I think maybe this is a good opportunity for us to give a shout out and a big thank you to all of those healthcare workers and humanitarian aid workers that went to the Ebola crisis, worked in the Ebola crisis, very often putting their own lives at risk. And as the story has pointed out, many of them, and I was staggered by that figure, 8 to 10% of the health working force landing up actually dying because of Ebola virus. So those, to my mind, those are the real heroes. They're often the unsung heroes. We never know who their names are. They're never, they're not on YouTube, and yet these are the people that really kind of laid it out there and got involved, rolled up their sleeves and saved the day. So well done to them, and thanks to everyone that got involved. Chris, next story for tonight. Hit us.
All right, our final story focuses on global health financing. So Jessica, I want to hear from you on this one. It's about funding the Sustainable Development Goals, or the SDGs. So this week was the start of the 3rd UN Financing for Development Summit taking place in Addis Ababa. And it's geared on setting up the financial framework to support the SDGs as we move forward. Now, while funding for the Millennium Development Goals, or the MDGs, was emphasized, or sort of emphasized reliance on international aid, the SDGs are going to require funding sources outside of that. Some of these sources, the ones that are emphasized, are going to be building tax revenue, domestic resources, and fiscal self-reliance. This self-reliance in the tax also includes the planned Addis Tax Initiative, which seeks to support developing countries' attempts to raise tax revenues and combat tax avoidance.
So I can jump in here, and yeah, I just have to highlight how important it is and will be in the future to find different sources of funding for health. All over the spectrum of health, we're looking for this, especially in HIV. The level of financing and funds from donors is going down, and countries themselves need to figure out ways of doing it. So there's been a lot of work going into this. There's a whole field called innovative financing that tries to find new ways. Some of the things you talked about were taxes, creative ways of using taxes. And I think in our pre-discussion we had talked about it's great to raise taxes, but how do we make sure that they go into the health funding projects that they need to be in? And there are ways. There are ways to earmark these taxes or specific funds that are collected from different levies and say this is specifically going to go into our health fund or for a specific disease. So yeah, these are. I would, if anyone's interested in this, just to kind of Google innovative financing, sustainable financing, because there's a lot of information and it's a hot topic right now.
Jess, talking about innovative financing, do you know that innovative financing includes a number of things, especially one of my favorites, and that you mentioned, earmarked taxes or sin taxes, taxes associated with things like tobacco. Yeah, there's a study done which actually from 22 low-income countries that suggests that a 50% increase in the excise tax on tobacco would bring in $1.4 billion of additional revenue to those countries. And that's the kind of impact that we're looking at to expand the fiscal space. Quickly, one more point here. I mean, I'm currently in Africa, in Nigeria, where majority of the economy is informal sector. So when we talk about fiscal space, it's very important to also think about, taxes come from the formal sector, but how can we best utilize informal sector to enhance our fiscal space? And that's something, if anyone has any ideas, we'd love to hear that.
Yeah. Just to follow up on both what Jessica and Solzhen said. So Jessica was just talking about the importance of the tax initiative. Right now, there's negotiations that have been completed in 5 out of the 23 countries they're aiming for. But in terms of combating tax avoidance, negotiations surrounding this initiative have taken place and completed in Ethiopia, Ghana, Kenya, Malawi, and Zambia. So that's definitely a start for the government stepping up to support developing countries on these issues. Additionally, I think that one of the most important things we can take away from this summit that's happening right now is that it's really the first time that we've had an incredibly strong recognition of how important finance is, and sustainable finance, to development progress within a lot of these countries, within the global south specifically. And we also need to make sure that the money that is raised is spent on those who need it the most. A lot of the people behind the government or the international tax laws are the global north, people from the G20 or the Organization for Economic Cooperation and Development, or the OECD. So just something to keep in mind.
I think that's a great point, Chris. Just to quickly throw in a nice example of how funding from the North is actually, and when I say funding from the North, actually, this is actually an interesting example of funding from the North and the South, has contributed to enabling countries to actually increase the extent to which they can engage with funding from their national sources. So pediatric antiretrovirals used to be incredibly expensive, prohibitively so, to the point that national programs were unable to afford them. So Unitaid, and Unitaid, interestingly, is financed. It's an agency that works to provide financing to impact on the market dynamics for drugs and other products for HIV, TB, and malaria. And Unitaid itself is not just financed from the North. In actual fact, there's many countries in South America and in Africa that provide finance into the Unitaid pot. Unitaid provided finance to do what we call sort of collective procurement, or they provided financing over a 5-year period to buy antiretrovirals for children at bulk, and in such bulk that they were in a position to, they did this with the Clinton Health Access Initiative, to negotiate lower and lower and lower prices for pediatric antiretrovirals, to the point that now national programs can afford to put them into their own national budgets themselves. So it's a nice example, and it's also an example of innovative financing that Jess was talking about, because the money for Unitaid largely comes from airline tax. So people buy airplane tickets, a small slice of that airline, that ticket then gets put aside to finance Unitaid. So it's a nice example of innovative finance, and it's a nice example of money being used in such a way as to enable countries to take over the financing for these products themselves. Susan, you had a comment.
Oh,
do we just want to move on to the next item?
Okay, sure, we can carry on. Yeah.
Well, okay, Jessica, you're going to talk to us about trypanosomiasis, or trypanosomiasis, in a way that we used to just talking about sleeping sickness and African trypanosomiasis. You're going to tell us about something slightly different today.
Right, yeah. So there was a paper that came out in PLOS Neglected Tropical Disease on a spatial temporal analysis of the distribution risk of African animal trypanosomiasis in Burkina Faso and Ghana. Now I said animals because this parasite also affects animals, and it has an impact on the sustainable development of the cattle industry. So that's why they were looking at it. So what the authors did is they modeled infection rates in both insects and cattle over geographic space and time, and they found good correlations between the two. And specifically, they found that the African animal trypanosomiasis risk was high during the dry season in areas that are near rivers, but during the rainy season, it was way more widespread risk. But this is an important study because this study does a lot of modeling, and it's showing what the risk is and how it changes over geographic space and time, and it allows for a clearer picture of what the risk is of infection in West Africa, which subsequently then allows for better control and management of the disease in this area.
And Jace, would this be? This wouldn't be a different variant of trypanosomiasis. These would be the same microbes that would infect humans as well, if I understand correctly. Is that right?
I would say so. Yeah, I mean in terms of the parasite, but what they did was they were looking at the insect vectors for the cattle.
Okay. No, the reason I'm saying that is understanding how these diseases spread amongst animals and the burden of disease in these animals is important if we want to understand the human relationship to this disease. I know you guys on the panel often talk to me about something called One Health, and I think and I see you all smile as I say the word. It's not something I know a lot about, but I think we're going to have to do an episode on TWiGH at some point on One Health and the fact that we're all in the same bucket.
Well, more of it, Greg, has to do with just the impact. Like they're looking at the impact on the cattle industry, which has an effect on health because people need nourishment, and this is how people have their lives and get their protein. So I think it's more in that context there, not so much on the impact on human populations directly with the infection anyway.
Okay, interesting stuff. Now, we're going to end off with Chris telling us about some job opportunities for those of you that are in the job market. Chris, talk to us.
Yes, I've actually got a bit of a medical resident experience. Since Katie can't join us today, it'd be strange to do Katie's Career Corners. So I'm just going to tell you about something through PIH, Mexico, their program, Compañeras en Salud, or CES-PIH. So they're basically saying they would love to host and mentor residents who want to do a rotation in rural primary or clinical health. So if you have, if you're in your medical training, either residency, attending, you have some experience in rural primary care and a functional knowledge of Spanish, they would love to host you and mentor you for about 3 to 5 weeks in Chiapas, Mexico. So we're going to go ahead and put up an email address that you can contact if you're interested in doing this type of internship or rotation, and be sure to get in touch with them because PIH is an outstanding organization, and the CES, the Mexico branch of the group, is no less outstanding. So
okay, thanks very
that's
much,
the
Chris.
website.
And for those of you that don't know, PIH is Partners in Health. That's Paul Farmer and company. They're a fantastic organization. We've spoken about them before. They're excellent. That's all for today, or for tonight, depending on where in the world you are. Thanks for watching. Come back next week, same place, same time. Get us on Twitter, Facebook, LinkedIn, etc., so on and so forth. Thanks for watching. Until next time, don't do drugs. Always do your best. Don't ever change. And good night.